Hello, I'm Michelle. I'm one of the cancer support workers at Bristol Haematology and Oncology Centre, and I'm going to be presenting this section on emotional well-being with my colleague Alex. So we know that cancer can impact on everything in your life, and there's an awful lot to manage. It impacts biologically on how you feel physically and the side effects that you might be experiencing, emotionally and socially, so on your relationships with others. But we want you to be receiving whole person care that includes your emotional and social well-being, as well as your physical well-being. Holistic, as you may well know, means being seen as a whole. Here's a word cloud of the emotions that some people say they feel when they have a diagnosis of cancer and are going through treatment. We've gathered them from people who've recently finished their acute phase of treatment, and the larger words are emotions that more people said they felt. You might recognise some of these emotions now, or you might well experience many of them as you go through treatment. But what's important to say here is that whatever emotions you have, they are normal for you. They may feel intense at times, but try to remember that these are a normal response to an abnormal situation. It's a situation which is abnormal, not you or your emotions. You might not have been through anything like this in your life, and so as your mind and your body adjust to it, you're likely to experience a number of different emotions as a result. So looking after your emotional well-being can help improve your own resilience. But how can we do this? Well, we know that taking good care of your emotional well-being and acknowledging the emotional impact that your diagnosis has on you will have a positive impact on the way that you cope with treatment and recovery. So we'd like to share a simple technique that you can take away to help you do this. And this technique is called ABCC. So the A is for acknowledge. The first step is to acknowledge how it is that you're feeling. And remember that there's no one way to feel. So some people do feel very motivated, but other people feel worried, angry, or sad, or experience other emotions as well. So just take a moment now to think how you're feeling. And remember that these are normal reactions to challenging events. So it's a good idea to check in with yourself regularly and to ask yourself how you're doing. The B of ABCC is for breath. So what happens to our breathing when we feel anxious? Well, it tends to get shallow and more rapid. But once we've recognised that our breathing may have changed, we can try and focus on it and slow it down. So this is almost like dropping an anchor to gently steady yourself, even if the ground or the sea around you might be stormy. And that's what this picture represents. So if you'd like to, we can take 30 seconds to practice a mindfulness breathing exercise. So start by closing your eyes if you want to, or if not, just focus your eyes softly and sit in a position comfortable for you. And now focus on taking slow breaths in and out. And make your breath out slightly longer than your breath in. And notice this breath coming in and how it feels coming in through your mouth and your nostrils. And how it feels coming out. Feel your feet back on the floor. Open your eyes and slowly come back to the present. We have relaxation booklets and we can signpost you to mindfulness resources to take away if this is something you think would be helpful. So why don't you give it a go, even if you think it's not for you? And just to let you know that mindfulness is a good technique to help you get to sleep as well. So there are lots of useful apps which have breathing exercises and techniques for mindfulness, depending on your level of anxiety and what works best for you. So here are a few that you can try out. The Valindra Mindfulness app was developed especially for cancer patients. I'd now like to hand over to Alex, who's going to do the rest of the presentation.
So I'm going to take you through the last part of the ABCC technique. And the first C is compassion. It's really important that we try to be kind to ourselves, like we would be towards each other. And we know that this can be really hard for some people to do, but now more than ever, we need you to be kind to yourself. Why don't you say something like, I'm doing my best, or giving yourself praise, acknowledging what you've done and recognising that you're doing all you can right now. It can also be through doing something nurturing. So that might be going for a walk in the fresh air. It might be watching your favourite TV show that nobody else enjoys. You can also refer yourself to the Penny Braun Treatment and Support Living Well Introductory Day. And the final C is choice. You can choose what you do and when you want to do it. Recognising your concerns can be difficult, but we know that this is usually more helpful to approach these concerns rather than to avoid them. How many of us have had a job that we've had to do, but we've been putting off? We often find that when we finally face it, it feels a lot better, and actually avoiding these can make our anxiety worse. Think about little steps that we can take. If it doesn't feel manageable to face a huge staircase, maybe just take one step at a time and choose when you want to take those steps and at a pace that suits you. It will increase your confidence and it will give you a sense of achievement. It's also extremely important to communicate. As we said in a previous presentation, people often want to help, but sometimes don't know how to do that. So talk to others and let them know what they can do for you. It's your choice what you want them to do and how to help you. So we know it's extremely understandable to face a range of different emotions throughout treatment. And when these become maybe too intense or persistent, or you feel that they're starting to get in the way of your everyday living, so for example with sleep, relationships, or managing the side effects of treatment, this is when we would want you to maybe raise to your cancer support worker team or the clinical nurse specialist team that you'd like a little bit more support. There's lots and lots of different support out there, so things like Penny Braun, there's the listening ear services, and there's also psychological health services based at both Western General Hospital and at the Bristol Haematology and Oncology Hospital. So please do ask us if you would like to explore any of these avenues. Thank you.